Well, welcome. I'm really excited to see so many people. This is great. My name is Dr. Muth. People call me Deb. I am a traditional naturopath and a women's health nurse practitioner. I have been practicing for, oh gosh, let me think, 18 years, I think, something like that. I've been doing integrative medicine for about 11, 12-ish years, somewhere around there. The older I get, the harder it is to keep track of how long I've been doing this. So we're going to talk a little bit tonight about cancer and hormones, and we call them steroid hormones. That kind of encompasses all the hormones, so we'll go through all of them. Give me a sense of how many people have somebody they know that's been affected by cancer in one way or another. Wow. How many people breast cancer affects? Pretty much everybody that knows. Good. What about colon cancer? Okay. Prostate? Okay. So a lot of things. We're going to cover a lot of those topics tonight. I think there's this sense of fear when we talk about cancer, which in some respects there should be, but the more information we have to arm ourselves with things, the less fearful sometimes it can be. And I'm hoping that tonight I can put some of those fears aside, but I also want to talk about how hormones are involved, but also how our environment is involved in cancer, because the reason we see cancer growing so rapidly and at much younger ages has a lot to do with our environment these days. So we'll talk about that. This is my clinic information, and we can talk about that more later, but I own Serenity Healthcare Center. It's an integrative medical clinic in Waukesha. It's been there for about 4 years. Prior to that, I co-owned Spring City Health Center with Dr. Toth and Dr. Konetsky. And Dr. Konetsky was my mentor, so to speak. So we're going to talk a lot about how do we restore hormones? Why do we restore hormones? Why steroid hormones are important? How cancer becomes an issue with them? And we'll dispel some of the myths around that too. And I'll just put this in there. I am rather informal in speaking, so if anybody has any questions while I'm going along, just interrupt me. Otherwise, I'll just keep gabbing on and on and on. So just interrupt me. Yeah?
I never saw it referred to as steroid hormones before.
Every hormone in our body pretty much is considered a steroid hormone. We think of steroid in different terms, but that's where they all come from. Hormones are made from cholesterol in our body, so I have a real pet peeve about people who want cholesterol levels at like 60 or 80, because when they're that low, we can't produce the hormones anymore in our body. We make everything from cholesterol, then we make something called pregnenolone, then we make DHEA, and from DHEA we make everything else, okay? Cholesterol levels, healthy cholesterol levels for you to make these steroid hormones should be no lower than 150. So even though we have some cardiac risks, we still don't want that cholesterol to be low. So normally what happens as we age, our genes change, things mutate, and when they mutate, that's when we get cancer. Okay? Every day our bodies kill off cancer cells if we have a healthy immune system. Okay? If something happens to the immune system and the immune system's no longer healthy, now it can't kill off those cancer cells, and that's when they start to multiply and divide. Naturally though, as we age, our genes get mutated from environmental things, from the immune system being low, and then when we have that mutation, cancer can form from that aspect also. Okay, these are all of our steroid hormones that we make in the body. So estrogen, progesterone, DHEA, testosterone, those are all pretty common known hormones. Cortisol is produced by the adrenal glands. It's one of the main steroid hormones that you hear us talk about. A lot of people have heard, I'm sure, that if your cortisol levels are high, it makes you fat. That is true to some extent. Pregnenolone, we talked about that. That's a mother hormone. Aldosterone, another hormone. How many people have heard about leptin? Okay, a couple people. So leptin is actually a steroid hormone. We haven't known a lot about leptin until about the last 5 years. And what we know about leptin is it acts much like insulin does. And so you can develop a resistance to leptin like we develop a resistance to insulin. And then leptin can act a lot like insulin And that can cause you to have a lot of weight issues and have you predisposed to diabetes. Now, very few practitioners are looking at leptin levels. They need to be looking at leptin levels and insulin levels when people have weight issues or they have a strong family history of diabetes. There is one herb that's been studied and known to bring leptin levels down, and it's called Ervingia. It's an Ayurvedic herb, and it can work really nicely to bring leptin levels down and can significantly help with weight loss too. So these are the hormones we're going to focus on tonight. So we talked a little bit about cholesterol already. Hormones are all made from that. You know, we have this issue in our country that we think cholesterol is the root of all evil. It's really not. Cholesterol by itself is not necessarily a problem. It's not a big problem for heart disease either. We have some major issues, yes, if certain types of cholesterol are bad, or if the sizes of our cholesterol are bad, then that creates problems for us because it creates inflammation in the body. And if you have inflammation in the body, come on in, sit down. If you have inflammation in the body, that's when disease occurs. So that's our biggest issue with cholesterol. We do know, though, that people who have higher cholesterol levels have a tendency to have higher rates of cancer. We suspect that part of that is for twofold. A, it's causing inflammation in the body, and inflammation is the root of all disease. And two, it can cause genetic mutations to occur. And when it causes genetic mutations to occur, then that's when we're going to see more disease states to happen. Okay? This is our steroid hormone pathway. So when we were talking about how those hormones are made, you can see cholesterol, pregnenolone. Then we make 17-hydroxypregnenolone, makes our androgen or our male hormones, DHEA, androstenedione, testosterone, estrogen's way down at the bottom, progesterone and cortisol up in the middle. So a lot of people, a lot of women assume that estrogen's high up on the scale, but it's actually not. It's pretty low on the scale of how and where we make our hormones. But we need for our body to shunt all of this in this pathway. If there's a block in the pathways anywhere in here, that's where we have problems. That's where we have disease. That's where we have symptoms of our hormones not working. If our body all of a sudden is making too much of our bad estrogen, which is called estrone, we're going to have a problem. If we're not making enough estradiol, we're going to get hot flashes and night sweats and vaginal dryness and all that good stuff. If we're not making this progesterone, we're going to have irritability. We're not going to sleep very well. We're going to be kind of agitated and anxious. If we're making too much DHEA, we're going to have oily skin and acne and oily hair, and we're going to be irritable. And if we make too much testosterone, we're going to be raging like men, road rage type thing if you think of that, you know. So anywhere along this continuum, if we have blips or we have problems that occur, that's where all of our hormonal imbalance comes from, okay? So we can test pretty much all of these hormones in different fashions, some by blood, some by saliva, some by urine, and every practitioner is going to have their own favorite way of testing. And you're going to see arguments on both sides of the fence, whichever testing you do. I'm here to tell you that testing is just a snapshot. It's really just for us to kind of confirm what we think is going on with your symptoms and to make sure we don't have you overdosed on a cellular level, okay? Some doctors prefer blood testing. Fine. Some prefer saliva. I prefer saliva. Some prefer urine. If you read Suzanne Summers' new books, she likes urine and she likes blood. She doesn't like saliva. Well, that's just because the doctors that she interviews and the doctors she works with don't believe in saliva. Most of the time, saliva is the most accurate, in my opinion. We can find a lot of overdose cellular levels that we don't find on blood. The key to remember is whatever testing you choose to do with your practitioner, if the picture doesn't match the symptoms, you got to test a different way. So sometimes we'll get saliva tests back that don't make any sense. Somebody will have a super high testosterone level or they'll have a super low estrogen and you know they shouldn't be having that. You have to confirm questionable results because sometimes people just, we can't measure. They don't make enough saliva or for whatever reason the hormones aren't in their saliva enough. Same thing with blood. When we test blood, those proteins are bound, the hormones are bound to proteins in the blood. And so you have to calculate them differently based on their age, where you are in your menstrual cycle, in order for them to be accurate. Okay? So takeaway message is we're only as good as the test, and the test is not perfect. Pretty much that's the way medicine is. All of our testing is great, but it's only really meant to catch a certain percentage of the population of people, which usually you can figure is about 80%. If you're that 20% that always falls outside the normal range, you're going to probably fall that way with these hormone testings too. I like a company called Health Diagnostics. It's actually a company that's created by one of our local lipidologists. And the reason I like it is because we can do cholesterol testing. I don't use it for estrogen and progesterone because I only use saliva for those kinds of testing. But if we're looking for lipid panels, if we're looking for leptin levels, we test a gene called APOE4 gene. The APOE4 is a genetic test that they've usually used for cardiovascular testing in the past. We have used it for cardiovascular testing. Yes, we want to know, do you carry the gene for Alzheimer's disease? Do you carry the gene for heart disease? Do you carry a gene that predisposes you to diabetes, to Parkinson's, things like that? Well, okay, so what? Now you know I have the gene. What does that mean? What do you do about it? Well, the goal of knowing the gene is if you carry the gene and you have this higher risk for these things, there are genetic diets that we can put you on to turn off that gene mechanism so we don't turn it on and cause inflammation in the body, and hopefully then we can prevent that disease from occurring. And this is something that was created by a nurse practitioner out in California. Her name is Pam McDonald. She worked with Wayne Dyer when he had leukemia and put him on this diet regime based on his gene type, and they've pretty much reversed his leukemia. It's a pretty important thing. So we see this it works very well. There is a specific genetic makeup that is more predisposed to cancer. So this is an important thing to know when we're working with cancer patients, because one size doesn't fit all with diets. And I think we've kind of learned that with Atkins. Would everybody agree? Everybody did Atkins. It was a big thing. We did this high protein. It was great. It worked for a while, and then it stops. Well, when we know your genetic type, we can put you on a specific diet for your genes, and it can really help with a lot of inflammatory diseases. We can actually measure insulin, leptin, adiponectin, so we can see if you're predisposed to diabetes with just a leptin level before we see the insulin levels go high. So it gives us a lot of really good information. IGF-1 is a growth hormone test that we do. So as we age, growth hormone goes down, and we can measure it with that. We have to be careful though with growth hormone, because if we give too much of it, we can stimulate growth of cells. And when we're talking about cancer, we can create some major problems with that if we're giving growth hormone and we have an unknown cancer circulating. Okay, so let's talk a little bit just for a moment about WHI trial. Everybody's heard of the Women's Health Initiative trial. Took a huge turn in the hormone world. Most women just hurled their hormones into the trash and said, I'm done with these synthetic hormones. I've been lied to. This isn't working for me. And shortly after that, they realized that they weren't themselves without their hormones, but they weren't really given a safe alternative at that point. And it's now taken us over 15 years to reevaluate that study. We've reevaluated that study more times than any other study has ever been reevaluated, only to find out the real significant risk in that study was the synthetic progestin, which we actually knew like 7 years prior to that. But because it's a women's study, we just keep studying them the same way that we've always done before. Like we had to have an estrogen-only arm of the study in the WHI trial. And we already knew from 20 years ago that estrogen alone with a woman in a uterus caused endometrial cancer. So we keep doing these same things that we know. I don't know, I guess we're trying to prove that what we know isn't right anymore. But it was the synthetic progestin that actually caused the bigger problems in that study. It was not the estrogen. When they left the estrogen arm of the study go on by itself without progestin, we did not see that same breast cancer risk that we saw with them combined. We knew already from Dr. David Zava's study that progesterone alone, given to a woman who had a breast cancer lump, the breast cancer lump shrunk and there was no metastases with only a couple of weeks of use with natural progesterone. So we kind of already knew those things were going on, okay? We also know that there are certain hormones that are secreted higher in breast cancer patients. Growth hormone, insulin, Cytokines, so cytokines are things like interleukins. They are what manage our inflammatory response. We can also use them to measure how well our immune system is working. Leptin is one of them. And something called secretome. That's kind of like an insulin. It's part of the insulin group. If all of these things are off, we're going to see higher risks of breast cancer. How many people know somebody who has diabetes? Okay. Automatically, those patients are at higher risk for breast cancer. How many people know somebody with the term hyperinsulinemia? A little bit less, one. Okay. Most people will have a hyperinsulinemia situation before they become diabetic, years beforehand. Their body's just secreting out all this insulin to try to bring their blood sugar under control. And when the pancreas says, enough, I can't produce this anymore, then diabetes occurs. So usually 5-10 years prior to somebody being diagnosed with diabetes, they've already been in this hyperinsulin state already. So we know, according to the American Cancer Society, that 232,340 new cases of breast cancer a year will occur. That is a huge, huge number. God bless you. We know that progesterone itself has been studied to reverse BRCA-mediated MDR, and it downregulates the BRCA genes that we're talking about, the ones that attach to progesterone. We actually have studies that have suggested breast cancer patients can be successfully treated with progesterone. Even the ones that have progesterone receptor positive breast cancers can successfully use progesterone. There's always kind of been this shield amongst breast cancer patients that once you've had breast cancer, you can never use any hormones again. Well, we're actually studying things now and saying maybe these women would benefit if we used some natural progesterone or if we used some estriol. I'm a little uncomfortable using estradiol in women that have had breast cancer because estradiol is your strongest estrogen. And if you do have an estrogen dominant cancer, we may feed that a little bit too much. I'm not uncomfortable, however, using estriol in breast cancer survivors, especially if we know their disease is gone. Estriol is your weakest estrogen. It's not so great at treating hot flashes and night sweats, but it's also your most protective estrogen. And we need that there to bring balance. Because most of the time, if we look at women who have breast cancer and we measure their estrogens, we actually do a fractionated test so we see how much estrone, how much estradiol, how much estriol they have. Most of the time, they're going to have too much of the estrone form of estrogen, and that's our bad estrogen. That's the type of estrogen we make the most of once we're postmenopausal naturally. So that's why we need to bring balance to both estradiol and estriol. Yeah?
You tell by body build if that woman has too much estrone?
No, the question was, can you tell by body build if a woman has too much estrone? And you can't, because that estrogen will look and act like other estrogens. The only way you can tell is if you test it and you get a ratio of it.
What did you say was the weakest estrogen?
Estriol.
Estriol, thank you.
Okay. We also know that women who have higher levels of free testosterone will have a higher risk of breast cancer. There was a time where we would give women testosterone without giving estrogen. It's really recommended not to do that anymore. If a woman's deficient in testosterone, you want to give some estrogen. Even if it appears like they have plenty of estrogen in their body, you want to give something. So if you don't need to give estradiol, you'd at least want to have a little estriol for protection there. And this is because of this risk factor with the higher testosterone. It converts to some estrogen, and that's one thought. But the other thought is it's a pretty strong androgen hormone, and it can cause some breast cancer mutations as well. We have not, however, found actually any evidence that any of the other sex steroid hormones increase the risk of breast cancer, which is interesting to say. Because if we're looking at the WHI trial and we're thinking estrogen did that, there's not one study that proves estrogen alone causes an increased risk of cancer. I have a lot of patients that ask, do I really need to do that spit test every year? They don't like it. I get it. It is really important to test your hormones at least once a year. Ideally, twice a year would be the best, and you'd want to test any time you have some big change. Like if all of a sudden you were doing great and something shifted all of a sudden, that's another time that you'd want to test. But otherwise, optimally twice a year, for sure once a year, because these hormones change. And if for something happens where all of a sudden you're storing all these hormones in your body fat tissue, we don't want to put you at risk for things that we don't know about yet, okay? You also want to make sure your liver is constantly clearing out these hormones. So we use a lot of silymarin or milk thistle to make sure that you're moving that hormone out of the liver, and that helps you so you don't store it so much in the body fat tissue. Okay, these are the real risks of breast cancer based on age. Oh, I'm sorry, go ahead.
Is high cholesterol levels related to high testosterone levels?
Not always. If you have high cholesterol, you could technically have any hormone that's elevated. It depends on how it's shunting down through that cascade.
And is high cortisol levels related to high testosterone levels?
No, because testosterone's down at the bottom of the cascade, cortisol's up at the top. It could correlate though to high progesterone levels. If you had too much progesterone, it could shunt over to cortisol if it wanted to. And then that could raise your cortisol level.
Too high of a progesterone level could exuberate too high of testosterone levels?
It could, because if you have too much progesterone, progesterone's way up here, testosterone's down here, and cortisol's over here, that progesterone's going to shunt into whatever it wants to. It would be hard for it to shunt into progesterone because it would have to come down and go to the side. You'd be more likely to see progesterone going to cortisol or estrogen than testosterone. DHEA though, yes, if you have too much DHEA, that will almost always shunt down into testosterone. Okay. So these are our risk factors by age, and you can see that we start out at a young age. 1 in 19,000 so are going to develop breast cancer. But by the time we get to age 80, 1 in 10 women are going to have breast cancer. It's partially because as we age, our immune system depletes and we can't kill the cancer cells, but it's always been like this. Most of us have seen women who've developed breast cancer and they were always 70 or 80 years old. It was rare to see a 20 or a 30-year-old develop breast cancer, unlike now. Now it's more common. Part of that's because of our environment, all the plastics that we're drinking out of, which I'm guilty of, all the plastics that we cook in, all the plastics that we store in, and all of our environmental, we call them exogenous estrogens, okay? They're everywhere. Our meat sources, our milk sources, they have all these steroid hormones that are put in there. So from little on, we're exposed to these hormones that our body doesn't know what to do with, okay? How many people have gone to the fair and you see all these young girls with the muffin top that we call it? Our age group, we didn't have a lot of that. If you had obese kids, they were obese. They didn't just have this muffin top. And it's not because they're wearing the pants way down over by their crotch these days. It's because they truly have all this estrogen built up in the midsection. And it's coming because they're being exposed to it in their milk sources when they're young, in their food sources when they're young, and their bodies don't know how to get rid of those things. And we suspect that that's part of the reason we're seeing younger and younger women developing breast cancer. There is some thought that maybe oral contraceptives being given at a younger age is contributing to that too. There's not a lot of solid studies, but it wouldn't surprise me. I mean, it's not uncommon for us to give oral contraceptives to 10-year-olds and 11-year-olds, because if they're 8 or 9 and they're getting their period and they're living in an environment where they don't have a lot of supervision and they're being taken advantage of, it's the choice of two evils: have a 10-year-old or an 11-year-old getting pregnant, or having them on the pill and protecting them in some form. So there is some suspicion there, but not a lot of studies yet to support that. Prostate cancer. Estimated 238,590 men will be diagnosed in 2013 with prostate cancer. This is a huge number. This is a huge problem. This is actually also an estrogen-derived problem. How many people would think that men have estrogen? Yeah. Men have estrogen like we have testosterone. We get too much testosterone sometimes. We're not nice people. They get too much estrogen sometimes and they cry a lot, you know. So it works the same way. However, if they get a lot of estrogen, they're going to mutate their genes and put themselves at risk for prostate cancer as a result. They also can put themselves at risk for breast cancer. And we are seeing higher numbers of males actually with breast cancer than we ever have seen before. If men are developing more breast tissue, it's not uncommon for them to develop breast cancer. And men oftentimes don't realize that. They don't think about that. So when they're diagnosed with breast cancer, it's usually pretty late. It's stage 4 by the time they find it, typically, because they don't have mammograms, they don't have thermography exams, they don't do breast exams. They never think that their breast tissue could develop cancer, but it can. Pancreatic cancer. 1 in 67 people this year will be diagnosed with pancreatic cancer. We talk a lot about breast cancer, which is high, but this is just as high of a problem. And also another scary cancer, because by the time it's diagnosed, it's usually stage 3 or stage 4. It's a pretty bad cancer. We think, based on some studies, that our female hormones actually protect us against pancreatic cancer. There is some studies that have shown that women who have used estrogen only without a uterus have a lower risk of breast cancer than participants who had never used hormones at all in this study. So they did a comparison study, kind of like a retrospective study. They went back and looked at that. Yes?
Can you repeat that again?
So what they found in a study where they looked at women from 1995 to 1996, they had a lower incidence of pancreatic cancer in women who had used hormones versus women who had never used hormones. So retrospectively looked at, I don't know how many people were in this study. I can't remember what I looked at. But they went back, and of all of women who had pancreatic cancer, they looked at the ones that used cancer or used hormones and those who didn't. So they had a control group.
If you had a hysterectomy
Mm-hmm.
and then used
Mm-hmm. And you used estrogen versus if you didn't use estrogen. Mm-hmm. Vitamin D and colorectal cancer. Huge thing. Vitamin D is huge. Most of us are aware how important vitamin D is. However, it is a big component to our cancer defense. Okay? We need vitamin D in the north more than we need it anyplace else because we don't get as much sun exposure. For those of us who don't get a minimum of 20 to 30 minutes a day of skin exposed sunlight, meaning no sunscreen, 3/4 of the upper body exposed, we're not getting enough vitamin D. Okay? Most of us don't do that. It doesn't count if you're getting the vitamin D through the car window. You have to have direct sunlight, okay? So there is 102,480 new cases of colon cancer diagnosed in 2013. Rather large number. What we know about vitamin D is that if you are deficient in it, you have a higher rate of inflammation in the body. We also see a higher rate of vitamin D deficiency in obese patients. And it's the obese population that tends to have the higher risk of colorectal cancer. So that's kind of what stimulated this study. We know that vitamin D actually blocks the signals for cancer cells, so it helps get rid of them. And it actually helps with our cancer regulating genes. So it helps to fill those in and utilize them a little bit more. We know that vitamin D actually turns off the mutation of our genes. So as we're getting older and those genes are mutating naturally, if we take vitamin D, we should be able to turn that mutation off. It also counteracts the growth potential of estrogen. So if estrogen is feeding a cancer, which it can, vitamin D will help to reverse that process for you. So very important to use vitamin D, especially if you're using hormones. Endometrial cancer and progesterone. So we've known for years that if we only give estrogen in a woman with a uterus, we're going to stimulate the lining of the uterus. It's going to grow, it's going to thicken, and over time it's going to develop bad cells, and it has the potential to become cancerous. We know that if we give progesterone, that process doesn't happen. If the lining gets too thick, you're going to bleed, and you're going to get rid of the tissues there, and that's going to prevent the cancer. That's the whole idea behind using progesterone. We also know that if we give enough progesterone to keep the lining of the uterus thin and give just the right amount of estrogen, we won't stimulate the lining of the uterus, and then you don't have to have a period for the rest of your life, which is on most people's agenda. They don't want to do that, despite what Suzanne Summers touts. And actually, I just read this weekend her perimenopausal book, and she's not being such an advocate of that anymore, because I think she's probably gotten enough grief from most women saying, I don't want to have a period anymore when I'm 80. I want to use the hormones, but I don't want to get the period. So now she's calming herself a little bit on that one. We also recognize that there are certain, we call them myometrial cells in the uterus, certain cells in the uterus that can be stimulated by certain cancers. And natural progesterone, not synthetic, but natural progesterone can actually turn off that, that gene or that development of the cancer in there and can protect it actually. Not even just from a growth perspective, but to actually turn off the genes as well. How many people knew fish oil was an anti-cancer product? Yeah, good, very good. There's a study out of Finland that showed that people who had higher levels of DHA and EPA had reduced breast cancer risks by 49%. That is a huge, huge number. Most people who are doing 1,000 or 2,000 milligrams of fish oil a day are still deficient. In our health diagnostics study that we use, or the testing that we use, we can actually measure fish oil. And I will tell you, out of probably 10 patients, I'm lucky if I have one that has enough EPA, DHA in their body, and all of my patients take fish oil pretty much. But they're still not getting enough to get this benefit. You sometimes have to really crank up the fish oil.
So how much? I was just going to say, yeah.
It depends on the person. And it depends on the type of fish oil that you're using, because not all fish oils are created equal. So on average, though, I would say probably 3,000 to 4,000 milligrams minimum of fish oil to get it up where you want it to be. Yes?
Does that include krill oil?
Krill oil is a vegan oil, but it still has some properties. This particular study was only done on fish oil, so I'd be hard-pressed to say krill oil would do the same thing. But if you could get enough EPA and DHA out of krill oil, you might be able to do the same thing. In theory, you should be able to. How many people have a hard time digesting fish oil? Burps up on them? A couple people, not too much. When you burp up fish oil, two reasons. A, you're not digesting it properly. You don't have enough HCl or hydrochloric acid in the stomach, so you need more of that in there to break it down. If you don't have a gallbladder and you're burping up the fish oil, you need more of the digestive enzymes from higher up that the gallbladder doesn't produce anymore. So everyone without a gallbladder should be taking digestive enzymes with every single meal they eat, especially a fatty meal. The other thing, though, is if you're burping up your fish oil and it has that really nasty taste to it, it's because you have a rancid oil. You don't want to use that then. It's rancid. Yes?
But if they're a tablet form, they should be rancid.
If it's a tablet form, you should still not have a rancid oil that it's made out of.
That's right.
Mm-hmm.
What if you have the opposite effect? You're not burping it up, but you're passing gas from it.
Well, then you're not digesting it lower in the digestive tract. So I'd still use digestive enzymes with it, because you should be absorbing it a lot quicker and higher up in the GI system. Mm-hmm. Now, one thing that you can do too is you can put your fish oil in the freezer and you can take it frozen, and then it passes through a little bit easier and you don't have so much digestive issues going on with it too. That works pretty good. Yes?
I was told that if your fish oil freezes,
Mm-hmm.
it's not a good thing. Because fish oil, if it froze, the fish would be dead, so.
Well, it's going to take a little bit of the effectiveness out of the fish oil, but you could freeze fish oil and it could be good for 10 years still. You can freeze fish oil.
So are you
Yeah.
saying put the capsules in the freezer?
Mm-hmm. You can put them in the freezer and then take them frozen
Really?
so that they get down further and digest. Mm-hmm. Then you don't burp it up so much. Yeah.
So how do you know if it's bad oil versus?
You burp up a really nasty fishy taste.
Okay, and if you're not digesting it?
Then you just burp it up. And then you just taste the pill. Like if you have a fish oil that's lemon oil, you'll just kind of burp up that lemon taste. But if you burp it up and it's really a nasty taste to it, that's a rancid oil. Yeah. Okay. So here's the study that shows if we have higher blood levels of EPA, DHA, we can actually reduce the risk of breast cancer by 43%. or I'm sorry, 73%. So 49% if we just take EPA DHA, but if we get our levels up high enough, we should be able to reduce the risk of breast cancer by 73%. So big numbers for us, especially since everyone in this room has been affected by somebody with breast cancer.
What did you say the recommended?
I typically will recommend 3,000 to 4,000 milligrams a day, but I test most of our patients to see where they're at. So then I know if they need more or they need less. But it's rare that somebody needs more than 4,000 milligrams a day. Okay, cardiovascular biomarkers. We talked a little bit about this. That's that APOE gene doing cholesterol particle sizes. We've actually seen, there are some studies that show people with cardiovascular disease, higher stress levels, have higher risks of cancer. We kind of know that. That's a given. If you have higher stress levels, your body's overloaded, you're making too much of your male androgen hormones most of the time, at least for a short period of time till you burn them out, and then you're not making any cortisol. And then your immune system's more depleted. So the goal that we keep hearing over and over again is immune system. That's the key to all of this. Stress, though, is huge. If you look at the number of women or men with cancer, most of them have a fairly stressful life or have had a period of stress just prior to the development or the diagnosis of their cancer. So that's really important. We'll talk about soy and hormones. Soy is a big controversial issue. There's studies that show Asian women don't get breast cancer like American women, and if Asian women come to America and they eat the American diet, they tend to have higher risk of breast cancer, and so we correlate that with the fact that they're not eating their traditional diet anymore, and maybe if American women had soy, we would be able to combat breast cancer more. Well, yes and no in some respects. Genetic makeup of different cultures allows you to break down different things. And there is some thought that American women do not carry or possess certain genes or certain abilities in their body to break down soy and utilize it the way Asian women do. And it's just a gene thing for us. So when you try to put that into an American lifestyle and get the same effects, you don't always get that. Part of the other problem we see with soy is that it's been chemicalized now. It's been changed. We have soy burgers, which are not really healthy, by the way. We have soy milk, also not very healthy. It's poor quality, low-valued soy. It doesn't give you the nutritional value of the traditional eating of soy in the Asian countries. Now, if you do highly fermented soy like tempeh or miso, that's a different story. Then you're getting a good high-quality soy, and that can be helpful for you. I have a hard time saying that that's enough to help reduce the risk of breast cancer, though, in women of American descent, because we have different genes than the Asian women do, okay? We also tend to think that having higher volume of soy in our diet helps with our hormonal symptoms, hot flashes and night sweats and things like that. I'd say for some people it helps, but the majority of the women that I've seen that have tried it will tell you it doesn't make much of a difference for them in those symptoms. Okay, did somebody have a question? No? Okay. All right, so how many people know about bioidentical hormones and what they are? Oh, good, I'm preaching to the choir. So bioidentical hormones basically means that molecularly your hormones are made in a lab, but are exactly the same of what your body would make. So if I was going to take a molecule of estrogen from your body and a molecule from an estrogen made at the pharmacy here and had somebody look at it under the microscope, they would look exactly the same. Nobody would be able to tell which is which. Therefore, it should act exactly the same as the estrogen does in your body, which is a good thing because then we have less side effects. How many women have either taken or known somebody that's used birth control pills and it takes them 4 or 5 different pills before they figure out the right one that meshes with their body? Exactly. Part of that's because we start out with a molecular structure that looks like estrogen, but in order for them to patent it, they have to change that molecular structure. It can't be a natural hormone in that product. So every time they change that molecular structure, we tend to get side effects because of that. And that's why they have so many different synthetic progestins, because they can't come up with one that works as good as nature does. So they keep trying to change it to try to find one that works, but they can't find it. Okay? okay? All bioidentical hormones are usually compounded. There are a few that are on the market commercially. They're still considered bioidentical. They're just made by a large pharmaceutical company. The problem I tend to see with those is dosing. You're very limited in the dose that you can get, and therefore if you're somebody who falls in between a different dosage range, we're not going to be able to get it for you. Most of the time we're going to end up overdosing you with those hormones than giving you what you want or what you need. Bioidentical hormones can be given in any fashion: capsules, tablets, transdermal gels, creams, lollipops, lozenges, rapid dissolve tablets, injectables, pellets, whatever we want we can make it in. We can make it in whatever dose. We can make it in a 0.01 dose all the way up to a 250 milligram dose. So we have a lot of variety there. Two things that you want to be aware of with our cancer risk factors: never ever use testosterone orally. Two reasons: A, it increases your risk for cholesterol and cardiovascular disease, and B, it increases your risk for breast cancer. Don't use estrogen in an oral fashion. It has to break down in the liver, and when it does that, it increases our risk for stroke and heart disease. So you want to use it in a topical form, or you want to use it in a rapid dissolve tablet or a lozenge. In a sublingual form, like a rapid dissolve or a lozenge or a liquid, you will swallow a small amount of it, but it'll be pretty minuscule where it's not going to cause the problems for you like it would if you were taking it in a capsule form. Okay? Yes?
How about the patch?
Patch is fine. It's a topical, transdermal, so that would be fine. A lot of women like it because it delivers the same amount of hormone over a 24-hour period of time until just before you're getting ready to take the patch off, and then a lot of women will start to notice that their symptoms come back a little bit because it starts to lose its effectiveness. But some women like that constant level. They don't like their hormones doing this all the time. Okay?
Testosterone, and what's the other one?
Oral estrogen or oral testosterone. Yes?
Is estradiol considered estrogen?
Correct. The other thing that you want to note about hormones is there is no consistent thing. This is not black and white. Hormones change every minute of every day. Therefore, if some days your dispensing tube looks like it's putting out more estrogen and some days it looks like it's putting out less estrogen, not a big deal. Your hormones are supposed to do this all the time, okay? It's not a problem. Now, we used to always talk about doing a continuous dose estrogen. I'm probably getting ahead of myself, but we'll catch up. We used to always continuously dose estrogen. There was a time where we never had women take a break. It was days 1 through 30, always the same dose, always the same thing for millions of years. Well, then we started thinking that maybe this isn't a good thing. And we started learning about things called hormone receptors. And these receptors actually pick up the hormones and allow us to utilize it. Well, if we're constantly dosing hormones without ever taking a break, we desensitize those receptors, and then what ends up happening is you start to feel like your hormone dosage isn't working the same way that it used to. So we started taking a break, and we'd say, okay, take a break 3 to 4 days out of the month so you break that receptor like it used to be when you had your period. When you had your period, estrogen and progesterone would be low the first couple of days, then estrogen would get high till you ovulated, and then that would fall off, and progesterone would be low in the beginning until you ovulated, and that would stay high until you got your period, and then they'd both fall off. And so we're trying to mimic somewhat of a cycle like that. When you think about how Suzanne Summers recommends doing it, she recommends something called a Wiley protocol, which I don't recommend. And I don't recommend it because of the high dosing of hormones that she expects you to do. It's nothing for them to dose 10, 15, 20 milligrams of estrogen during a month cycle, and anywhere from 200 to 400 milligrams of progesterone. Now, I don't know if any of you have ever been overdosed in your hormones, but those are pretty high dosages. I actually did a trial of the Wiley protocol because I don't do anything that I don't tell my patients to do. And I thought, I'm just going to try this. I'm scratching my head with my colleague. We both tried it at the same time. And I said, I'm a little nervous about this. And she said, it'll be fine. Come on. And I'm like, okay. I made it up to about 8.5 milligrams of estrogen in a day. And I felt like I was pregnant. My breasts were so huge and so sore, I could hardly take it anymore. My husband loved it. He would come around and say, "Oh my gosh, what's going on with you?" And I'm like, "Get away from me. This is terrible." And I like having small breasts. They don't get in the way. And by the time I got to the progesterone, and I was at 200, moving up to 300 milligrams of progesterone, I was not a very nice person to be around. I was bloated, I was swollen, I was miserable, I was tired. And I called my colleague and said, "I'm done. I'm not doing this, and I'm not recommending this to my patients." Yes?
What was the point of doing it and increasing it and going up so high?
The theory behind the Wiley protocol is that we should be dosing hormones exactly like what we did when we were younger and we always had a period. And you want to cycle them. So you would always be changing your dose of estrogen about 5 or 6 times during the cycle. And then you'd do the same thing with progesterone. You'd come up with the estrogen, come down, go down with the progesterone, come up and go down. So you were constantly changing your hormone doses about every 2 to 3 days. The concept is based on an animal model, that this is how animals do it. People are animals. This is the way it should be done. And you want to give enough hormone to provoke a period for the rest of your life. That's the whole concept behind the Wiley protocol. And I had been at a conference when this first kind of came out several years ago, talked to some of the compounding pharmacists that were doing the Wiley protocol, and every one of them said, "Oh, don't do this. Your patients are not going to tolerate it. They're going to be calling, they're going to be crabby, they're going to be unhappy, it's too complicated." And I thought, well, that's kind of what I'm thinking, but I'm glad I'm hearing it from you. But I was dumb enough to try it myself anyway. But it was a good experiment for me, because if this is how we feel, why would we do that to ourselves? Do you know what I mean? I think the theory behind the protocol makes a lot of sense to me. Trying to cycle the hormones so that it's naturally doing what it's supposed to be doing, but you can cycle it with small dosages without provoking a period and without provoking the symptoms that you provoke with large dosages. And there is some thought behind that, that if you're constantly turning off those receptors, you're protecting the body against cancer. It's a complicated protocol to do. Not everybody wants to do it. We usually do somewhat of a modified protocol with it, where we'll cycle the progesterone in the latter half, or we'll give estrogen in the beginning and progesterone in the second half. But I'll tell you, a lot of women, once they get estrogen again, they don't want to give it up in the second half. And once you get progesterone, you don't want to give it up in the first half because you're sleeping and you feel good. So doing smaller dosages tends to be the way that we would rather do it then. Yeah.
What if you've had a hysterectomy? I mean, periods aren't going to happen.
Periods aren't going to happen.
So you still could do that.
You would still cycle it because you still have all the hormone receptors in your body. And so you still want to turn them off and on. What you would typically use then is the lunar calendar month, or you just use the calendar month, because most of us can't figure out where the lunar cycle is. And most of us on any given day are too busy to figure out where the lunar calendar is, so we just use the calendar month and just make it easy then if we're going to cycle it. And some people have to cycle several times a month because that's how they feel better. And some people, it doesn't matter. And there's still some people that say, "I like the constant dosing, just give me 3 or 4 days off a month to turn the hormone receptors on and off, and I'm good with that." So there's lots of different models. There is no right or wrong. It really ends up being, how do you feel best with what you're doing? Okay, that's the takeaway message. Okay. I talked about that already. We talked a little bit about stress. Let's talk a little bit more about stress. We actually know that if we could measure stress hormones, and there are some that you can measure, things like cortisone, norepinephrine, noradrenaline, we can measure some of those things. They actually can, if they're high, can increase your cancer risks. Now, some of us know that they're high because there's a cancer tumor there, but if you have higher levels of certain stress hormones like this, you are putting yourself at higher risks of cancer for longer periods of time. So if people tend to have a lot of norepinephrine or a lot of glutamate or a lot of GABA in their body circulating for long periods of time, we do worry about the fact that they may be potentially at risk for cancer if we're seeing some of that. Cortisone typically is not always a bad thing. A certain amount of cortisone is good. It can actually kill cancer cells, okay? It can stimulate growth hormone. We just don't want a lot of cortisone. And you definitely don't want a lot of cortisone at the wrong time of the day. That's probably the most important thing. You want the majority of your cortisol first thing in the morning so you can get up out of the bed in the morning and get going with your day. You want the least amount at nighttime. You don't want your cortisol to be circulating a lot at night because then you're going to stay up at night. But you also don't want all your cortisol on that front part of the day. Like I'll see a lot of women that don't have anything in the morning when they wake up at 7, but they may have a ton of it at noon or at 3 o'clock, and that's not a good thing either. We want that circadian rhythm to flow. You should have your highest power in the morning. It should drop by half at noon, drop by half at 4, and be nearly non-existent by midnight. That's a good cortisol panel. Okay? Okay, stress. Stress is a big part of this. How many people feel like they live in a fight or flight response? Yeah, we have a lot of that. A lot of it sometimes we don't even realize because we're always in that reactive mode. You know, when you're in that reactive mode over and over and over again, you're constantly pumping out cortisol. So you've got this flush of cortisol that comes through, and then it calms down and you're good again, okay? Somebody pulls out in front of you, you slam on your brakes, you pump out this huge amount of cortisol to deal with the situation. We usually look around and go, okay, everybody's all right, and then we just kind of keep going on. But we don't take any downtime from that influx of cortisol that comes. We just kind of keep going on with our day. That is the important part. When we were cave people, we would get this fight or flight response. You know, tiger comes, they're going to chase you, you run, so you live. Afterwards, though, you went to the cave and you slept for 3 days to recover. How many people do nothing for 3 days after a fight or flight response? Not me. I'd be in the bed all the time. So we don't have that downtime. And most of us as women tend to feel guilty about taking that time for ourselves to quiet our mind and clear our heads and just relax a few minutes of the day. But you need to do that on a regular basis, especially if you're having a lot of fight or flight modes during the day. It's really an important thing to do. Even if you have to lock yourself in the bathroom for 5 minutes and just take some deep breaths and clear your head and tell yourself that life is wonderful, despite whoever it is you're dealing with that's making your life not wonderful at that moment. And you have to just kind of relax. Do some deep belly breathing like we used to do in choir class. Do some good deep belly breathing, put yourself at ease again, and then you can go on with the day. Then that kind of makes up for the 3 days that we're not sleeping in the cave afterwards, okay? How many people have heard sugar feeds cancer? Big, big problem. Another reason why we see so much cancer. Our American diet is awful, awful with cancer and with sugar. We have all these preservatives that we don't know what do to the body, chemicals we can't pronounce, and we don't know where they come from. That's one problem. Sugar levels that have never been as high as they are right now. We sugar everything because we have to make it taste good. Partially because if they didn't put it in there with all the preservatives, it'd probably taste pretty bad. But the other part is we want everyone to be addicted to whatever it is we're eating. You've probably all heard that the manufacturers of Oreos have spent billions of dollars researching, somebody's probably going to kill me because I'm on tape for saying this, billions of dollars to research chemicals they can put in the Oreo cookies that make us more addicted to them, make us stop eating just one. Lay's motto, you can't stop with just one. There's a reason we can't just stop with one. It's not because we're weak, it's because they put stuff in there to make us want it more and more. And this is a big problem for us. And the first thing that I would tell any patients that is diagnosed with cancer is you've got to get rid of the sugar or you're going to continue to feed the cancer. Yeah?
Can I ask something?
Sure.
Does this go also for sugar in fruit?
Not the same. Fruit sugar is different. Yeah, it's more the white refined sugars. I don't restrict fruit sugars in my patients. I do say make good choices. You know, don't go from eating a half a bag of Oreos to a bag of apples in a day, and don't go making baked apples because it tastes good. You know, there's different things in the fruit with the fibers and the lectins and everything else that convert the sugar differently. And you certainly want to do fruit sugars that don't convert as quickly, so like your berries and your citrus fruits and your green apples, and try to avoid more of your melons and your bananas. Save those for special treats. And with fruits, you always want to do them with a carbohydrate or a protein or a fat, because you slow the metabolism down of the sugar then, and then you don't get these rapid spikes and falls, and then that makes a big difference for you. So like do apples and nut better, or apples and almonds together, things like that, and that makes it better. Yes?
What about like stevia?
That's an excellent question. Stevia is not the same. Stevia, xylitol, agave, coconut, I don't know what you call it. It's like a agave, but it's made from coconut now. Those sugars are not the same. They're natural sugars. They don't feed cancer that we know of, and they don't spike the insulin level. So it's different. It's mostly that refined white sugar. That's the big problem.
So honey's okay?
Honey is okay.
What
Black
about
molasses.
grains they convert?
What's that?
Grains.
Grains that convert to sugar. All of your food is going to convert to sugar in the body. That's what feeds the brain. So if you're going to do grains, you always want to do them with a protein or a fat. Don't ever do them by themselves. So with butter on them or nut butter. Don't do them with jelly though, unless you're going to do some other form of protein, because then you have 2 carbohydrates together again. Okay. I know most of the oncologists debunk this myth. I have a very dear friend who has cancer, terminal stage 4, and I told her this, and she went and asked her oncologist, and he said, that's not the problem, you're dying, eat whatever you want. And I thought, you know, I can understand that at some point. If I was on my dying bed, I'd be asking for ho-hos, a Coke, and whatever else it was that I thought I was going to miss when I went in the afterlife. But if I'm trying to fight cancer, I certainly wouldn't be putting those things to my lips. You know, no matter how much weight you lost. Yeah.
I literally saw a person, well, actually several people. I worked for a large company, and especially there was one man, and he was fairly young, and well, he was very overweight, and I saw what he ate, sweets and stuff all day long. All of a sudden he ended up in the hospital and had cancer. And he was gone.
Yeah.
I mean, in no time. And I always, when I saw him, and when I saw, I just felt, I knew it was going to happen. I says, you know what, he doesn't look right to me. And I think, I see him what he's eating, oh my God.
It is a lot. A lot has to do with what we eat and the nutritional value. You know, years ago, we ate sweets, but our moms made them from scratch. You knew exactly what went in them. And most of our parents didn't use the full amount of sugar. I remember my mom baking cookies, and it would call for a cup of sugar, and she'd put a half or a quarter of a cup of sugar, or she'd mix applesauce in it instead of all the sugar. So you didn't have all of that amount of sugar, and we didn't have all this refined stuff that went into it either. And nothing was genetically modified, and that's another big problem, is all of this genetic modification that we have no idea what we're going to do. Our European friends are very smart. They don't allow genetically modified foods in their food sources. And I have patients that are gluten intolerant that can't handle any wheat that's made in the US, but if you get them a European wheat, they have no problem with it. So when we think that genetic modification is okay, not okay. Not okay at all. That's why our French friends can eat all the wonderful rich French food and not get fat, because it's not genetically modified. You know, there's a big difference to all of this stuff in there. So sugar is a big problem. I'll tell you another thing that Dr. Konetsky taught me many, many years ago. There was a study that was done, I want to say like the early 70s, on breast cancer patients. They actually removed the tumors, looked at them under the microscope. This was before we ever thought cancer was caused by a virus, which it can be. But they did this study, and 60% of the tumors they looked at were full of parasites in these breast cancer women. And it was the first time that they started thinking that maybe cancer is caused by some kind of foreign thing, a parasite, a bacteria, a virus, or something. Well, now we know that that's what can cause cancer. Viruses can cause cancer, mutated viruses, bacteria infections. But I will tell you, parasites is a gross topic. Nobody likes to talk about it. We think the US is so clean. We are the farthest thing from a clean society. I don't care how much hand sanitizer we use. We have a society that travels. We all eat out. Many of us, including myself, walk barefoot outside in the grass. And all of those places are places we can pick up parasites. And we have a serious parasite problem in this country that most people are not addressing. We have no problems deworming our animals. And most of us sleep with our animals. They're like kids to us. When I was a kid, I'd lick my ice cream and give it to the dog, and then I'd lick it, and my grandmother would say, "That's disgusting. That dog licks its butt. What are you doing?" And I'd look at her and say, "Leave my dog alone, Mom." But I mean, that was the reason. You didn't do that back in the day. Now we do those things. We sleep with them. We let them kiss our face. We do all that. There is a huge parasite thing here in this country, and we need to be cleaning ourselves like we clean our animals. You know, twice a year you do a parasite cleanse, whether you need it or not, and you make sure you're getting rid of those things, those little critters that cause problems in our body for us. Okay, see how I get off on tangents? I didn't even plan on talking about that stuff, and I disclose a lot of secrets to you guys. So we talked a little bit about diet. Let's talk about the different diets. So we've got the low glycemic index diet, we've got the paleo diet, we've got the Atkins diet, we've got a genetic diet, we've got the GAPS diet, we've got South Beach diet. They're all wonderful diets, okay? There's not anything wrong with any of them, except one's a little extreme on one end, one's not extreme on the other end. The problem is that if your genetic body type says that you need a different diet, if you need more protein or you shouldn't have any protein, and you're doing a high protein diet, you're going to turn on your inflammatory markers. I have patients before I started learning about the genetic diet that had diabetes, and I put everybody, all my diabetics at that time were on a low carb diet, high protein, exercise every day. I had patients that when we started doing this diet, I would look at their insulin levels, and they were doing the diet good, but their insulin levels weren't good, and their blood sugar levels were not good. And I'd be like, how can they not be doing good? This is the diet of choice. Well, we'd get their genetic test back, and lo and behold, guess what? They were a genetic type that wasn't supposed to be eating all that protein. And you take their protein away, and you give them, lo and behold, more carbs, and more fruits and vegetables, and more fat, and their blood sugar and insulin level goes right down where it's supposed to. And they lose 30 pounds in a month, just like that. It's because they were eating now an anti-inflammatory diet based on their genes, not an anti-inflammatory diet that someone created that we think was great, and we didn't study on all these people. Okay? Yes?
How do you know what your genetic diet should be? How is that testing done?
It's done by a blood test.
Okay.
You measure an APOE4 gene, which is a gene that any lab can do. It'll come back with two numbers. There's about 17 different variations that could come up. And based on that variation, we look at that and we correlate it with some research that was done by Pam McDonald and a bunch of naturopaths out of Canada. And we know then, based on your genetic type, how many servings of each food group you should have on a daily basis. We also base it on calories, so the more calories you have, the more servings of food that you have.
Have they found any correlation between the APO4 genetics and blood type? There was a gentleman or doctor who,
yeah,
the concept of eat right.
Eat right for your blood type.
Yeah, and that actually seemed to help me. I don't know if it was psychological or whatever, but it made a difference.
There has not been any studies to compare the two. I know a lot of people that like the Eat Right for Your Blood Type diet. Dr. Konetsky promotes it to all of his patients. He likes that diet. I would say, for the most part, most people eat that diet and do pretty well based on their genetic or their blood type. And they'll say, yeah, I kind of knew I didn't do well with this food or that food. But it's still not as specific as your gene type.
Okay.
Yeah. In my opinion, but
I'm sorry,
yes.
do you have a reference or a source to learn more about that?
About the APOE diet? There's actually a book that Pam McDonald wrote called The Gene Diet. That's one source. It's an okay book. It'll give you a lot of information. If you actually do a Google Scholar on APOE, you will come up with a ton of research. They've actually researched this genetic issue with autism. And there are certain genetic types that are more prone to autism as a result of it. And so then balancing their diet based on the genetic type can sometimes help their autistic symptoms. That's pretty great. Cruciferous vegetables, big issue with anybody using hormones. If you don't like to eat a lot of cruciferous vegetables in your diet, you got to take them in a capsule form. So the two main things are DIM, D-I-M, or IC3. They're just cruciferous vegetable compounds that you can take in a capsule form every day. It helps so that you don't make too much estrone in your estrogen, and helps with something called a 2:16 hydroxyestrogen ratio, which is your bad estrogen to your good estrogen. So it helps to push that out so you're not circulating too much of your bad estrogen. Okay, yes?
What type of vegetables would these?
So cruciferous vegetables are like your broccoli, your cauliflower, those kinds of things.
How much?
I would say you'd probably want to do, if you were doing them by intake, probably 3 to 4 servings a day, every day. Most people don't like to eat that much of them because it gives you a lot of gas. So it's easier to take them in a capsule form. Yes?
Does it matter if you cook them, or should they be raw or cooked?
Raw or lightly steamed, but preferably not cooked because then you take all your nutritional value out of it. Yes?
I've had friends who, a couple of them that were on DIM, and their periods were all over the place.
Mm-hmm.
What's happening?
Because it's converting that estrogen, your bad estrogen, it's starting to push out excess estrogen. When it does that, it can make your period become a little erratic until it balances it out.
So it should resolve.
It should resolve, yeah. It might take a good 2 or 3 months to resolve it, but it should resolve.
What's the value
Yes.
of it again? Remind me.
The value,
Taking the dim and nice.
because it prevents you from making too much of a bad estrogen called estrone, and then the 2:16 hydroxyestrogen ratio, it prevents you from making too much of your bad hydroxyestrogen.
So you can just buy those at the store?
Yep, you can buy them over the counter. Mm-hmm.
And then how much?
It depends on what brand you're using. So look at your brand because each one's going to be different based on a capsule amount. But usually it's like 1 to 2 capsules a day depending on the brand that you're using. Okay, so cancer prevention, daily exercise, 365 days a year. Never take a break. You don't get Sundays off like God did. Every single day, okay? That's important. How much exercise? I would say mild to moderate. You don't have to kill yourself with exercise. A 20 to 30 minute walk, 20 to 30 minutes of yoga, especially if you do a power yoga. You don't have to go do a 45-minute spin class every day, you know. You don't have to do 30 minutes of exercise continuously. You could take a 10-minute walk in the morning and a 10-minute walk at lunch and a 10-minute walk at the end of the day, or do a walk in the morning and do yoga at night or something like that. You can mix it up. It's actually better if we break up our exercise throughout the day. If you want to try to get exercise in and there's just no time, when you have to go to the grocery store, walk at the farthest end. Park at the farthest end and walk to the grocery store a little bit further. That all helps when we do those little kind of things. Take the stairs instead of the elevator when you're at places, okay? Genetic diet, reduce our stress, number one thing. Improve our immune function. That is key. If you want to get rid of cancer or if you want to prevent cancer, you have to have a properly working immune system. Most of us, unfortunately, do not. If you know somebody or you're somebody who's constantly getting colds and bronchitis and flu and bacterial infections, you have an immune system that's not working properly. You're already at risk for cancer. You need to reverse that. You need to fix that, okay? We need to look at viral and bacterial loads. A lot of us have been exposed to Epstein-Barr virus, which is the virus that causes mono, HHV6, which is a herpes virus, lots of bacterial infections. There's a lot of Lyme disease in our state. We are an endemic state for Lyme. A lot of people have it. They don't know it. It's being underdiagnosed. We have lots of chronic strep infections that people walk around with, and they'll say, I always have this sore throat, but it never turns into anything, or I'm really achy and I'm really tired. That's a signal that there might be some kind of bacterial infection or viral infection going on. You need to have that evaluated by somebody who looks at things differently than your traditional doctor with an acute infection. Because if you've got a lot of these loads that are high, they're putting a strain on your immune system. Allergies. We all tend to live with our allergies, but that's another strain on the immune system. So if you think of the immune system like a rain barrel, and each time we add one more of these things on, it just is eventually going to spill over, and that's when the immune system's not going to function properly, and we're going to put ourselves at risk for cancer at that point, okay? Parasite cleansing, talked about that twice a year. Easy thing. Helga Clark makes a parasite cleanse you can use. She and Dr. What's his name? Reich, I believe. I might be wrong on the name. Make something called a zapper. You can get it from Southern Herb out of Madison. There's a website, southernherb.com. They make this little zapper thing. You put it on, you wear it for a couple of days. It kills the parasites. You do it a couple of times a year. Works like a charm, but I will tell you, be careful. If you kill parasites too quickly, you will not feel well. And sometimes if you kill them too fast, you will literally see them crawling out of your skin. So be careful with that, okay? I've known one person that has done that before I started treating parasites. Yes?
Where do they basically live? Is it in the colon?
Most of the time it's the colon.
And so when you kill them, how do they come out? In the
The
feces?
stool.
And they come out dead, I hope?
Sometimes, but not always.
Well, I mean, because I've seen, you know, worms, parasites in dogs.
Mhm.
So obviously, they get the bacteria and they come out and they're live
Sometimes
and well.
they're alive and well.
And until they die.
Yep. Yep. And
Does the zapper kill them?
there are people who get floaters in their eyes or the squiggly lines. That's a good sign. Or itching rectum, especially at night during the full moon. If you're itching a lot in moist, warm places, that's a sign that you have parasites.
What does the full moon have to do with that?
Parasites get very excited around the full moon. It's an energy thing. They become very active around the full moon. That's part of the reason we think that people tend to be crazier around the full moon too, is because the theory is that these people are full of parasites and that's why they're kind of crazy during the full moon. Itching skin, generally itching skin, brain fog, memory issues, anxiety, especially around the full moon. If you're anxious more around the full moon, that would be a sign that you might have parasites. When you pass them, they may look like all kinds of different things. They might look like little black poppy seeds. They might look like little white chunks of, the best way to describe it is like a white chocolate kind of thing in the stool. Sometimes you'll literally see something that looks like a nightcrawler crawling on the ground. The skin, you could see that. Sometimes you just see things that look like seeds or like little long pieces of rice. They'll look like that, depending on what kind of parasite it is. You can see all kinds of different fun things.
What is the parasite that the dog would get? You know, the babies, the puppies. What kind of, I mean, they come out like in a blob and then they all curl together. And they look like little corkscrews.
Oh, I know what you're talking about.
Parasite is that? I think they get it from their mother's milk.
Yeah.
Bacteria.
I forget what they call that.
Did you do this with children?
You can do this with children, yes. You should do this with children.
All ages?
Yes, all ages.
What
Yes.
was the name of the parasite cleanse you recommended?
It's a Hulda Clark. Hulda Clark, Hulda, and then Clark, separate name. Parasites, when they come out, sometimes like when you're talking about them being intertwined like that, sometimes what you'll get is a nest of parasites. And if you've ever seen like a nest of fish eggs, that's kind of how the parasites look when they come out in a nest. They'll have this jelly kind of fill around them and they're protected. They're growing like that. So sometimes you'll see a lot of mucus-like stuff that comes out, and that's also the parasites too. Yeah. Parasites are a big thing, yeah.
So if one goes on vacation, Mexico or whatever, so it's probably best after that you give yourself a
Very best after that. If you travel outside of the country, when you come back, do a parasite cleanse. The easiest thing to use for parasite cleanse is wormwood complex, which is also artemisia. Wormwood complex, black walnut tincture, and cloves. Those are the three things that you use for parasite cleansing.
Also garlic.
Garlic is
A lot of
pretty good
garlic.
too.
So how much garlic do you have to use?
I'd say probably a quarter of a clove a day.
That's all?
Yeah.
Has the same effect as this Hulda?
No. Garlic would not have that same effect as the Hulda Clark protocol.
Clark is the place that
Hulda Clark is the name of an herbalist. She has a parasite cleanse program that you can get. She puts all together like the wormwood and the artemisia and the cloves, and there's a couple other things that she uses, and there's a whole program that you can buy. And then she's got a kit that, you know, this week you do this week you do that, this week you do this.
the
And
only one that
no, there's other people that do that too. She's got the best protocol though.
Is it
And
any,
she's the least expensive.
sorry, is it any floaters in your eyes or just like a lot of them? How do you, that was a new one. I've never heard that.
It doesn't usually matter the volume,
Okay.
but it's like when you see those squiggly lines going and you see the things that kind of, they kind of flash past your eyes, the floaters that flash really quickly. No, they're usually open. Yeah. Proper nutrition balance. Always making sure that we have more fruits and vegetables than we have other things. Yes?
What do you think about the acidic and the alkaline?
Alkaline versus acidity. I think that is a good concept. We should be more alkaline than we should be acidic. I'm not sure that it does everything people say that it does. I mean, it's not the end-all be-all cure to every disease, but it certainly helps. Bacteria, viruses, parasites, they can't live in an alkaline state. They love an acidic state. So if you're more alkaline, they have a harder time surviving, and your body has a better opportunity to fight things off. So the pH diet, some people do a pH diet. I think that's okay. It's a healthier diet. It's more fruits and vegetables. It's not a lot of protein, not a lot of grains, things like that. So that's okay too. Proper hormone balance is key. If you're going to do hormones, they've got to be balanced. We've got to be able to test a couple of times a year. You got to make sure that you're using as many of the hormones as you need in the proper amount. That's important. Okay, we want to optimize vitamin D. We know insulin is a huge proponent to this, so we've got to get our insulin levels down. Fasting insulin has to be 5 or less. Okay? Leptin levels have to be normal. They're usually titrated based on age. So you want that to be low. You want your cortisol level to be balanced. We don't want high cortisol levels, but we also don't want real low cortisol levels either, because if you have too low of a cortisol level, your immune system's not going to work either. Cycling hormones, we're starting to see more and more research that that's a better way of doing it. So whether you do continuous and you stop for 4 or 5 days, or you cycle at different times of the day, we want to cycle those hormones. We talked about measuring hormones already. Detoxification. Excuse me. We want to be able to detoxify the body. Glutathione is one of the main things that we need to detoxify our body, and unfortunately, a lot of us are deficient in glutathione. Okay, glutathione is an amino acid. It can be given topically. Its best way is given by IV. It can be given in a liposomal oral form where you swallow it in a thick liquid. Most of the time that doesn't taste so good. People don't like it. It kind of looks like snot. I don't like it. But it needs to be in that form so it doesn't degrade into stomach acid. So most people will use it in a topical form, or they'll use it in an IV form. Okay?
So the capsules aren't good today?
No.
Unless they're very pricey.
They're very pricey, yes. How many people know about something called MTHFR, methyl tetrahydrofolate? Okay, a couple people. Methyl tetrahydrofolate, hence the reason we call it MTHFR, because you can't spit that word out very well, is a gene mutation that can be found on, in just about anyone. It prevents the body from converting folic acid to folate. Okay? It is a much bigger problem than we've ever thought it is. Not commonly tested in reproductive ages, which can be a huge issue for our young children. Because if we're taking all this folic acid to prevent genetic birth defects and you're not utilizing the folic acid because you have a gene mutation issue going on, we're going to have some children that are born with some problems. We also know that if you have this gene mutation, depending on the severity of the gene mutation, you're going to have a higher risk of stroke. You're going to have a higher risk of blood clotting, and there's going to be certain things in your Krebs cycle as to where we break down toxins that are going to be blocked, and you're not going to be able to make that process happen. So if you have an MTHFR gene mutation, most of the time you will have to use glutathione for the rest of your life, either in an IV form or a topical form, to make sure your body's detoxifying properly. This is a blood test that can be done. It can be done by any doctor in any lab, and it will come back fairly easy to read. And then if you do have this mutation, there's a certain protocol you need to follow with a special form of folate called methylated folate, so that you're actually utilizing the folate. There are some studies that have been shown that people who are using too much folic acid, especially men, we're seeing higher risks of prostate cancer in those men who are using folic acid. My guess is if we go back and we look at those guys, they probably have this gene mutation, and that's actually what's causing it. It's not just the fact that it's folic acid, but it's the people with the gene mutations that aren't utilizing the folic acid. And that's what we're seeing as a problem.
Is there
Yes?
a difference between a gene mutation of glutathione and just a low level of glutathione?
Yes. Some people can just have a low glutathione level that do not have this gene mutation. And then that's two different issues going on. Yes?
Does hair testing show all that?
No. Hair testing will not show this MTHFR mutation. There is a company called 23andMe that does gene testing. If people are interested, they test like, oh gosh, I don't know, it's like 5,000 genes they test. It's an overwhelming thing. But they will test, and they do test this and the APOE gene, and they test every gene you can think of. And so you can see if you're at risk for certain diseases or cancer, and specifically every cancer that you can come up with. And just about every disease you can think of, they have a gene that they can test to see if you carry the genes for that. And if you do, then you need to work with somebody that knows how to make sure those genes don't get turned on so you can prevent the disease. Yes?
Well, if your family history, there was a lot of cancer, you obviously have those genes too.
Not necessarily, because you get one gene from your mom and one gene from your dad. So depending on which one you got lucky with, you could have a good gene or you could have a bad gene. And the other thing is their genes could be mutated simply because of what they were exposed to in their environment at that time that caused the cancer. They may not have the genetic risk factor for it. For instance, I have a grandmother who has Parkinson's disease, and I did this 23andMe test. I don't carry the Parkinson's gene, which is great to know. I have a strong family history of heart disease. I don't carry the risk factors for heart disease, but I would have thought that I did, because if I look at my familial tree, I follow my dad's side of the family, and that's where all the heart disease is. So I would have assumed that would have been me, but I don't carry any of the gene factors for heart disease. So, I mean, sometimes that's a good thing to know. You have to be in a right frame of mind, though, if you do this test. It's not expensive. It's like 99 bucks. It's cheap. But you have to be prepared that if you have something in that gene factor, like say it tells you you're going to have Alzheimer's disease, or you carry the genes for Alzheimer's disease or leukemia or something like that, you have to be prepared for that information. It's not something you want to go into without a lot of thought and processing of what you're going to do with that information, because it can be scary if you get the wrong information, and you know, you need to know what to do with that. Yes?
Do you recommend it to your patients?
I do, yeah, I recommend it to patients who want to know that information. Yeah, you can order it yourself. It's not something that has to be ordered for you. You can go right to their website. They'll send you a kit. Yes?
I was just going to mention, I actually just did gene testing and got it back, but I had a lot of information going into it, so you have to take it as you're going to do something. You have to be ready to be proactive.
Right.
And that's what I've done.
Exactly.
But it's still, you know, you kind of suspect things, but you don't, it's different seeing it on paper.
Yeah.
Just thinking about it, but it's really, there's so much you can do to change your outcome, and now you know that you're just not taking fish oil to take fish oil. You're really possibly changing your outcome.
Right. And you'll change your diet and you change your lifestyle because of some of the information you know in this genetic test. And it's not because you're doing it just because. So on the days where you're really like, I don't really want to sit here and cook for 2 hours and make all of this, or I'm sick of taking these 20 pills for something, you have a reason behind why you're doing these things. And it's because your end result is that you want to live healthier longer. And that's a good thing. And sometimes people want to share this information with their children, and they want to be able to have that information to pass to their children. And some people don't want to know, and that's okay too. You don't have to know this information, you know? It's what you want to do with it that's important. And like you said, being proactive is huge. If you're just going to take the information and not do anything with it, save the $100, go to a nice restaurant. But if you're going to take it and you're actually going to do something about it to change it, then it's worthwhile to do.
How is that testing done when you order it online?
It's a saliva test.
Okay.
So you spit in a tube. It's a fairly large tube. You send it off in the mail. It takes a few weeks to come back, though. It's like 4 or 5 weeks for it to come back. It's kind of fun. They do some of this for genealogy. So if you're willing to share your information, they'll share it, and they'll, in their database, they'll hook you up and say, oh, you're related to so-and-so based on this genetic marker. So for people who want to find their lineage, that's another way that they use it. They also give you the option to be part of a research study, and they'll utilize your genes. They'll keep them for like a year, or keep your saliva, not your genes, but they'll take your saliva, and then they can test different things. So if they think they found a new gene, they can use your saliva to try to identify different things. And it's kind of a nice research thing. But I actually, when I did it, I found a 5th cousin from Norway, which was interesting. So, but it's kind of fun that way too. You can do some testing. There's a test called the organic acid panel, or an OAT test. that also tells you how well you're detoxifying and breaking things down. So if you're questioning whether or not you're detoxifying chemicals or metals or things like that, this gives us a little bit more information to determine whether or not you're having a problem with that. That's a good test to do as well. Gluconate. Gluconate's typically found in apples, grapefruit, oranges, Brussels sprouts, broccoli. This has also been found to help with detoxification. So if you think you're having a problem detoxifying, you can use D-gluconate. It also helps get rid of your 16-hydroxyestrogen, which is your bad form of estrogen, different than estrone, but it's a mutation part. But you can use D-gluconate for that, and they sell it over the counter. All right.
I'm sorry, so which
Yes.
is, so you have the two types of, so the D-gluconate and then this glucose. Should you use both of them for detoxification, or which one should you use?
So you can use D-gluconate for detoxification. You can get that over the counter.
Yeah.
Are you talking about glutathione as the other
Yeah,
one?
the topical.
Glutathione you can also use as something to help detoxify. Glutathione detoxifies pretty much everything. D-gluconate is going to detoxify some general things, but it's going to focus more on hormones and detoxify that 2:16 hydroxy ratio. If you're converting too much of your estrogen to 16 hydroxy ratio, which is a bad thing, it will help get rid of that. But you'll have a little bit more general detox too. So good.
Is that for
Yes.
women that are on bioidentical hormones?
You could use that on someone who is on bioidenticals, yes.
That was kind of my question,
Mhm.
that
Or the cruciferous, you could use either one. I wouldn't use both, I would just use one or the other. Some people like one over another. Some might be easier to find, or some may have a food source in one that they're allergic to, but it's not in the other that they're not. So you have some options there. All right, environmental exposures. Mold is huge. Mold is a very big reason we get cancer because it disrupts the immune system. Chemicals, huge problem with the immune system. All the chemicals we're exposed to in our cleaning products, throw your cleaning products out, go back to baking soda, vinegar, you can use essential oils, but don't use all the chemical stuff because that is really a problem. We talked about the plastics and the estrogen. If you're going to use plastics, you want to look for these symbols because you want to avoid them. If they have a 3, a 6, and or a 7, or 3, 6, and 7, you don't want to use those plastics. If you have a 1 is thought to be safe, but I'd still be careful. Even if I had a 1, I wouldn't freeze it and I wouldn't heat in it. Like, don't use it in the microwave. But make sure that you're not using anything with a 3, 6, or a 7 on it because those are known problems for plastics. Okay.
Even just for storing cold.
Even just for storing cold, I would avoid. Yeah, I'd go back to storing in glass if you can, and heat and cook in glass.
But the stuff that says BPA free is okay?
I still wouldn't use it.
Really?
Yeah, because I don't trust the chemical companies. And, you know, the coatings sometimes, you know, there's always this, oops, we didn't know this had it in it type thing. So I still wouldn't do that. Yeah, I'd avoid that. Don't use saran wrap, you know. Try to get away from those kinds of things. I don't recommend microwaves. Avoid the microwave. There's no good use for it. It's radiation. We don't need to radiate our food. We have enough of that. We get enough of that when we travel in the planes, you know. Yes, no microwave food. Go back to stovetop cooking. GcMAF. This is a new thing. New for me, but also new to the US. Only been used here maybe a couple of years, if that even, maybe 2 years, maybe 3. Is illegal in the US to get. You can get it from Europe. On the bottom here is a website, gcmaf.eu. You can order it there yourself. There's tons of research at that website where you can get on GcMAF. GcMAF is a immune system regulator. It commands the immune system. It works with vitamin D, so it's important to make sure before you use it you have high vitamin D levels. We usually also test something called nagalase before we use it. If nagalase is low, you definitely want to use GcMAF. It is a huge cancer fighter. It like just goes after them, eats them up, and gets rid of them. We've used it with some of our stage 4 cancer patients. We've seen their tumor markers drop by half in a couple of weeks.
What
It is.
exactly is that?
What's it
It's
made out
a
of?
vitamin D activator. It is a natural product. It is not cheap. It runs about $400 a vial. A vial will last you, depending on your dosage, maybe about 6 to 8 weeks. It's expensive, but it works very well. There are people in Europe that choose to only use this instead of chemo. If you were looking to treat cancer with GcMAF versus chemo, cost for GcMAF may cost you about $20,000 to $30,000. Cancer treatment's going to cost you a couple $100,000. So it's a huge difference when you're outlaying the money. No insurance coverage though versus insurance coverage for other things. But
Why you
yes.
can't do
So would you do both, that and the chemo?
Yes, I would. I have patients that have done that. They've used GcMAF and then they've used radiation or they've used chemo.
All three?
Well, you know, sometimes they'll do radiation, then they'll do chemo, or vice versa. They'll do one over the other. But yes.
But you say this could cure it itself.
There is some nice research from Europe that shows that there are people that have used this alone that have chosen not to use chemo or radiation and have had success with fighting the cancer.
Does it also work for viruses, Epstein-Barr?
Yes.
Stuff like that?
Works for Epstein-Barr, works for autism, works for chronic Lyme disease. So it's got some good properties and some really good potential for use. Yes?
So how long does it take for this in terms of I know you said in a couple weeks you'll see a reduction, but I mean, how long would you go on this before you would decide that maybe it's time to hit the radiation or the chemo?
Normally, you're going to see a response with GcMAF in about 8 to 12 weeks. If you don't see any response at all, you know it's not working. And then you would abandon treatment because it just doesn't make sense to have the cost outlaid. It's not something that you start and you have to do for the rest of your life, though, which is nice.
Right, so 8 to 12 weeks.
Yes?
How does this work with autism?
Good question. The theory behind autism has changed over the years, and there is some thought that there are bacterial viruses and other components that are causing the immune system to go haywire and causing the autistic symptoms. So if you can build their immune system and get rid of the bacteria and viruses, you can change their symptoms. And sometimes you can get a child to recover from autism. And so a lot of the autistic doctors, like Dr. Brown who works with me, is using GcMAF in that fashion. Now sometimes when they do that, they'll actually see their symptoms get worse before they get better when they use GcMAF, and then they have to titrate the dose differently for them and use smaller doses and not go up as quickly to get the benefit. But it works to build the immune system. Yes?
What about cat's claw and inositol? What do you call it?
Inositol?
Mushroom stuff, maitake.
Yeah, those are great things. The question was cat's claw, mushrooms, and inositol. Do those things work to fight against cancer? Yeah, they do. Especially if your cancer is viral based or bacterial based, they can work very, very well. Now, if your cancer is coming from a mold base, you might have to be careful with the medicinal mushrooms because you don't want that to feed that. The other thing that would be key to know before you'd start herbal treatment is which side of your immune system is dominant. So we talk about this Th1 and Th2 dominant immune system. If you're dominant on one side, there are certain herbs you don't want to use. And if you're deficient on one side, there's certain herbs you do want to use. So that's important to know when you're treating the immune system. We used to say, oh, green tea is awesome, everybody should use it. Not so. If you've got an immune system that's stimulated on the wrong side and we give you green tea extract, we're going to make that immune system worse, not better. So it's important to know that, especially when you're dealing with a deficient immune system. Yes? It's a blood test, and you do something called a cytokine panel. And when you get that lab result back, you can see which ones are high and which ones are low, and you then know which side the immune system is dominant on or deficient on. Anybody can do it. Lab can do it. Yes. Yeah. Other questions so far? Yes. I am on Highway T, right across the street from Good Harvest.
Yeah.
We're in the Siemens building. Siemens put its name on the building when they moved in, so we're in the Siemens building.
And Dr. Konetsky is there too?
Dr. Konetsky is still there, yes, and Dr. Brown. Okay, so this is a little bit more about how GcMAF works, and I always mix up that word. So it actually blocks the cancer cells, it inhibits cancer cells, it stimulates macrophages so they run around and eat up all the cancer cells. It actually helps a lot with chronic pain, believe it or not, too. So that can be, yeah, arthritis. It increases energy because it fixes things on the mitochondrial level. It gets you to detox, pushes things out for you, and actually inhibits inflammation, and that's one of the other ways it works on pain. Okay. Oops, too fast. So in summary, steroid hormones do play a role in cancer, but not necessarily the way we always thought. Hormones are not always the culprit. They can feed cancer, but they can also prevent cancer. We know environmental changes can prevent cancer, help reverse things. Immune system's key, and nutritional support is key. Okay?